Hello and welcome back. So here's the last curriculum I took with the Barral Institute, which is called Visceral Vascular Manipulation. I'm just going to read to you real quick what that is about. So that's, again, Jean-Pierre Barral created it, and it's the hands-on therapeutic approach that focuses on the arteries, veins, lymphatics, and connective tissue surrounding the organs and vascular system. Because basically every organ has a vascular connection, so it needs the blood, it needs the oxygen. And the method is based on understanding that healthy circulation and fluid dynamics, just like how it always is in osteopathy, it's like the fluid dynamics, rule of the artery, blood flow, are essential for tissue vitality, healing, organ function, and nervous system regulation. So we as practitioners, we use, again, very gentle, precise, manual techniques. So while craniosacral sometimes is a little bit more broad and biodynamic is like very broad, the visceral manipulation, neural manipulation, visceral vascular manipulation is very precise. So you have to know your anatomy. We need to know what it feels like if we're on a nerve, if we're on a blood vessel, if we're on the organ. Again, in our classes, we use a pen to draw on our partner the outlining of the organs, so it's precision. It's not just putting hands on it, even though when we work it often just looks like nothing is happening, but there's a lot happening in our hands. The more training we more have in our hands. So precise manual techniques to assess restrictions, tension patterns, impaired movement within the vascular pathways and surrounding fascia. We improve the mobility, adaptability of these structures. Therapy aims to support circulation, reduce congestion, enhance tissue nourishment, and restore better communication throughout the body. It's often applied in cases involving chronic inflammation, pain, edema, post-surgical restriction, autonomic imbalances, and complex systemic dysfunctions. And also back to the topic of like anxiety. If you're eating the wrong thing and you might not even be aware that it's causing a reaction, you can get shortness of breath, you can get congested, you might even get an anxiety attack. So there's a lot more to anxiety. When you throw your back out, it rattles your nervous system. So the body likes to be in homeostasis, everything has to work together. The classes that are taught in the visceral vascular curriculum, 2 classes, one for the upper body and one for the lower body. Thank you for listening.